animals or pets?
We hear so much about hypertension, and I'm with you. I never wondered if my dog had high blood pressure, but I will in the future. Dr. Jill, our favorite vet, joins us live in Orangevale. Tell me that Diva, my favorite boxer, does not have high blood pressure.
Oh, fingers crossed.
She doesn't have high blood pressure, but she's the model for the segment. Check this out. She's got her little cuff on. Isn't that cute? She's just hanging out here this morning because, of course, you know, we bribed her with treats. But, you know.
Well, how common is it, doctor?
Well, you know, it's actually fairly common, and it's not just about hypertension. It's about underlying disease. For example, kidney disease, seizures, all kinds of stressful events. You know, a lot of people don't realize that blood pressure really plays a huge role in pets, and some of the symptoms are missed by people that could have been avoided so that the disease doesn't progress.
What are those symptoms?
Well, you know, a lot of people don't realize their eyes actually get swollen. Some of them actually, their eyeballs will bulge, and it can be confused with glaucoma. So you want to make sure to have your veterinarian check their eyes. Sometimes panting, seizures, certainly, you know, dilated eyeballs, if they're circling, blood in the urine. All these symptoms can be a manifestation of hypertension in pets.
Look at that face. Now, is a blood pressure test something you normally do if somebody brings their dog or cat in for the annual checkup? And is this a cat thing as well?
You know, it is definitely a cat thing. Actually, more cats than dogs a lot of times because cats get kidney disease. But if your pet has a cardiac problem or a kidney problem, it becomes the norm for your veterinarian to want to check those things routinely. It's quite simple, as you can see. It's not invasive. It's just a little cuff. Now, if you do an EKG on them, because this machine, this is a phenomenal machine, I just want to say, it actually reads blood pressure, central venous pressure, EKGs. It does the whole ball of wax. We use this to monitor in anesthesia now as well. It's become the standard of care, so make sure to ask your veterinarian if they're doing that during any anesthetic process. You know, it's definitely becoming standard of care, and we are putting our pets on hypertension drugs, and we're using human drugs as well.
Now, I know we're running out of time here, but I wanted to ask, when we talk about hypertension, I know in people, usually it's associated with someone who is overweight or has some issue like that. Is that the case for our dogs and cats?
That can certainly be one of the issues that contributes to hypertension. But again, a lot of times cardiac disease, kidney disease in pets can be the underlying cause. So make sure to have your pet checked once a year. Ask for blood pressures. Ask to monitor. It's not an overly priced procedure to have done. And again, not painful or invasive.
Look at that mellow doggy down there getting her ears scratched. Merry Christmas to Diva. Thank you very much, Dr. Jill, as always. And if you have any questions, you want to schedule an appointment with Dr. Jill, check out our website. It's Dr. Jill with a Y, drjill.com, or give her a call. You see the number right there on your screen.